Stephanie Wu. I'm a nurse practitioner student at Maryville University. Today I will be performing a head-to-toe assessment for advanced physical assessment. There's 612. This is my patient, a 44-year-old male. I've asked the patient to empty his bladder and remove his clothes. Ready for the head-to-toe assessment. And I've obtained a set of vital signs, and are all within normal limit. His history of present illness, past medical history, social and family history also have been submitted. Let's begin. And if you have any pain or tenderness upon my palpation, please let me know. So we'll start with a general survey. This patient is alert and oriented. As you can see, he's well groomed, well nourished, and appropriate. And his head is in the midline. I don't see any tremor, any tics, involuntary movement, and his hair and there's no bald spot, and it's gray and black mixed, and is evenly distributed along the hairline. There's no infestation, and there's no lice. Skin is yellow undertone, and I could see that his skin has multiple nevi, and which is our normal finding. There's numerals of skin tags along his neck region, which is our normal finding also. Okay, so his head, I'm going to go ahead and palpate his head. His head is round, and I don't see any lesion. There's no mass palpated. There's no tenderness. Okay, so I'm going to go ahead and go down to his TMJ. Can I have you open, close, side to side, front and back, and I don't feel any crepitus, ticking, locking, or clicking. I'm going to go ahead and palpate your sinus, maxillary sinus, and frontal sinus, and there's no tenderness along those sinuses. All right, we're going to go down to his eyes, and I can see his eye features, his nose and his mouth is all symmetrical, and his eyebrow and eyelashes are evenly distributed. And there's no redness or edema noted around the eye, and there's no discharge. I'm going to go ahead and palpate your eye, okay? Close. There's no tenderness or any mass upon my palpation, and I don't see any ptosis. I'm going to go ahead and palpate your lacrimal apparatus and puncta, and there's no tenderness, there's no discharge or any pus coming out from there. Okay, I'm going to have you look up the ceiling, and his conjunctiva is pink, and cornea is clear, and sclera is white. And all right, so everything looks good. We're gonna do some vision tests, and prior to the assessment, I've obtained his vision acuity, which is 20/20, based on the Rosenbin test. Okay, so let's start off with the cover and uncover test. I'm gonna have you look straight ahead and at a place, and keep your eyes straight, okay? And cover and uncover test is to test to see if there's any leak-like and nice neck miss, and there's negative. All right, I'm gonna do a confrontation test, and this is to test your peripheral vision. And I'm gonna have you hold on to one card. You cover one eye, and I will cover mine, and I'm gonna wiggle my fingers on your peripheral field. So you just keep your eyes looking at me. Okay, and you'd say now when you see any wiggle fingers.
No. No. No.
All right, let's cover the other eye, and we're gonna do the same.
No. 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 No.
Good. Okay, so his confrontation test is negative. Now I'm gonna test for your extra ocular eye muscle by having you look at this device and keep your head still. I want you to follow the tip of this device, okay? And this is to test cranial nerve 3, 4, and 6. And his muscle and cranial nerve are intact. Okay, so now I'm gonna look into your eye pupil and see how your eyes are reactive to light. Okay, look straight ahead, and I'm gonna shine a light on your pupil, and I can see his pupil is 3 millimeter, and they're reactive to light. They're round, and all right, I'll have you also follow. Just look at this tip, and it's coming closer to you. Just keep your eye on it. All right, so his eye is reactive to light and consensus and accommodations. All right, you're done with your eye test. We're gonna go down to your nose. Your nose is in the midline, and I could see that your nostrils are patent. There are some hairs, and your septum is also in the midline, no deviated septum. Inferior and superior turbinates are also visible. There's no lesion, there's no discharge or any pus coming out from the nose. Alright, so next go down to the mouth. Your lips is pink and moist, and they're also there's no lesion, there's no bruising or any abnormality along the lips. Okay, can I have you open? And I can see your mouth, your teeth are slightly yellow, gums are pink, and buccal mucosa are moist. And I can see the hard palate and soft palate. And can I have you say ah?
Ah.
Okay. So anterior, posterior, pharyngeal are also visible. I can see your tonsil are +1, and they're also visible. Your tongue is in the midline. Can you have you take your tongue out and wiggle it and say Okay. And his tongue, there's no coating or any hair on the tongue, and they're moist and pink. The ducts are all free of exudate or pus. Alright, I'm gonna do solicit and gag reflex. So, okay, good. Alright, so I could see that his cranial nerve 9, 10, and 12 are all intact. Alright, I'm gonna do a quick cranial nerve test. I'll have you wrinkle your forehead and smile, clench your teeth. Alright, and puff your cheek. Good. Alright, I'm gonna have you close your eyes. This is to test. Do you feel it?
Mm-hmm.
Do you feel it now?
Mm-hmm.
Feel it now?
Mm-hmm.
Okay, so cranial nerve 5, 7 are also intact. I'm gonna check